Good morning, everyone. I wanted to do a video on reasons for gingival recession. A lot of people have messaged me and they tell me that their teeth are sensitive and they want to know why their gum level has dropped, and there's a few different reasons why this happens. The first reason would be periodontal disease. So we have a layer of jawbone and we have the teeth, right? And our gums cover the jawbone. If we have bacteria that gets down between the tooth and the gum, it's anaerobic bacteria, so it doesn't need oxygen to survive, so it gets really, really deep down in the sulcus of the tooth, and it eats away at this little periodontal ligament, which is kind of like a bungee cord that holds your tooth into place. When this damage happens, our body is designed to try to preserve itself, so our bone starts to try to move away from this bacterial inhabitant. And so when the bone level drops, the gum level drops as well. So periodontal disease and oral bacteria is the first cause for gingival recession. Sometimes you're just brushing too hard. It takes about 5 grams of pressure, which is incredibly light, to remove biofilm from the teeth. People that are in there just railing on their teeth and scrubbing really hard, these are people that tend to scrub their gingiva away, and causes recession. Anytime the gingiva level drops below the enamel, we have cementum and then we have dentin that shows. And dentin is really sensitive. It's kind of like a superhighway directly to the nerve of the tooth. So that's when we start getting sensitivity issues. The other cause is clenching and grinding your teeth. So when you're really clenching and grinding, which is typically at night, which is a parasite symptom, by the way, when you're clenching and grinding, your tooth is kind of like a fence post. So think about if you grabbed a hold of a fence post and you start rocking it, right? The dirt is going to furrow out from around the base of this fence post. And it's the same thing with a tooth. When you're constantly putting occlusal forces or bite forces on the top of a tooth, and that tooth is shaking, it starts to furrow out bone. And so we have bone loss, and anytime we have bone loss, we have gingival recession. So brushing too hard, using too abrasive of a toothpaste is another issue. Sometimes you're brushing with the correct pressure, but you're using something that's abrasive, like baking soda. Baking soda is great, but it's also an abrasive. So when people are using baking soda, I tell them to either brush really lightly or only use it maybe 2 or 3 days a week. The same thing for charcoal toothpastes. They're fantastic. I love activated charcoal, but it's also an abrasive. So if you're using that daily and you're a hard brusher, this can lead to gingival recession. There are some homeopathics that people use with relative success to regenerate oral tissues, and I'll try to do another video on that.